Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. First of all, let me introduce myself. My name is Azura Tsabita from Universitas Muhammadiyah Yogyakarta. Here, I will present to you my research paper with the title, The Effectiveness of Hazmat Suit in the Offline Skills Lab of Dental Students Universitas Muhammadiyah Yogyakarta during COVID-19 pandemic. This presentation includes introduction, literature review, research method, result, discussion, and conclusion. Moving on to the first part, which is introduction. It has been 2 years since the World Health Organization declared the global outbreak of COVID-19 had become a pandemic and brought us to the new normal era. The high number of COVID-19 cases puts everyone at a high risk of being infected, especially in dentistry fields, both dentists and dental students. The dentistry department Universitas Muhammadiyah Yogyakarta switched the learning system online. However, since the sophomore and junior year students enter the clinical semester, all skills lab activities need to be done offline. Therefore, the dentistry department announced the new regulation for offline skills lab, which requires the students to wear hazmat to prevent the transmission of COVID-19. However, a few days after the skills lab started, the number of COVID-19 cases increased. Thus, the effectiveness of hazmat in preventing the transmission of the COVID-19 is questionable. This study aims to find the effectiveness of hazmat in preventing virus transmission through the number of COVID-19 cases among dental students. To obtain the objective of the study, there are 2 research questions. The first one is, how many students were diagnosed positive in the past 2 months? And the second one is, what is the relationship between the number of cases and the effectiveness of hazmat? Moving on to the next section will be theoretical framework. Definition of hazmat. Hazmat is one of the components of personal protective equipment that every healthcare worker has used during the COVID-19 pandemic to reduce the transmission of the virus. There are 2 types of hazmat. The first one is a gown, and the second one is a suit. The gown type covers the body up to the knees and commonly used in level 1 or level 2 of PPE. And the suit type covers from the head to the ankle and used in level 3 of PPE. Most healthcare workers in dental clinic use the suit type due to the high risk of being infected. The next one is, why should dentists wear a hazmat? The main reason for using hazmat during a pandemic is because COVID-19 could be contagious through droplets and aerosol treatment. The literature states that the infected droplets are intact and abide in the air for 3 hours, which explains why the dentist should wear hazmat. The next section would be empirical review. The appropriate PPE in frontline health worker is important to protect themselves and prevent the transmission. If the staff implements the procedure properly, the appropriate use of PPE can significantly reduce the possibility of being infected. Another literature said that treatment in dentistry field involves the exposure of saliva, blood, plaque, and any other aerosol treatment such as restoration or scaling, which puts a dentist at a high risk of being infected in doing treatment during the pandemic. Therefore, a pre-treatment like teledentistry is needed to obtain patients' information about their general condition. But the wear of hazmat is also a must to reduce the possibility of being transmitted. The next one is research method. This study conducted a quantitative method to discover the number of COVID-19 cases among dental students to determine the effectiveness of hazmat suit in preventing virus transmission. The researcher shares a questionnaire to be filled by the participant to obtain the data. The question consists of one main question and several additional questions to support the data. The participants in this study are dental students from batch 2019 and batch 2020, with a minimum of 10 people in every batch. Every participant has a right to fill out the questionnaire, but the first 20 people are acceptable. The researcher will approach the participant through the broadcast message on WhatsApp group. The information regarding this study will be in the description of the form. After obtaining the data, the researcher analyzed the answer and concluded based on the important point. Moving on to the result. Chart 1. Have you ever detached your mask during skills lab activities? This is the first question, and the result is 14 participants do not take off their mask during skills lab, and 6 participants detach their mask due to the skills lab requirement to make the dental impressions. Participants should print other people's teeth on alginate to make a study model to support our learning. The next one is chart 2 with the question, have you ever been confirmed positive COVID-19 in the past 2 months? And the result is 6 participants diagnosed positive COVID-19 in the past 2 months. The next one is the third question. When were you confirmed positive? Is it before the offline skills lab started or during the offline skills lab week? So from the participant who diagnosed positive in the past 2 months, half of them were confirmed positive during the skills lab week. The next one is last question. Have you ever visited another place other than campus? So the result is most participants, which is 19 of 20 participants, visit another place other than campus and putting them in a high risk of being infected. The next one is discussion. The result shows that most participants obey the obligation to wear a mask during the skills lab activity and only detach the mask to make the dental impressions. However, some participants confirmed positive while trying to finish the skills lab requirement outside the campus. Since most participants have done printing phantom teeth in a previous semester, the current semester needs to be done on a person to practice and determine the treatment based on each participant's friends. An offline skills lab takes a higher risk for students and the instructor, but the skills lab must be done offline since the clinical semester started. The number of participants who confirmed positive COVID-19 shows that the usage of Hazmat during skills lab is quite effective in preventing the transmission of the virus. However, there is a bias in this study. Since the most participants have visited other places outside the campus, we cannot determine whether they got infected on the campus or outside the campus. Based on the previous study, the selection of protective equipment and clothing is essential to reduce the exposure to COVID-19 transmission among healthcare workers. However, the protective equipment, specifically Hazmat, doesn't work effectively to reduce the transmission of alone. Any additional infection prevention is needed, such as environmental environmental disinfectant and cleaning, frequent hand washing, and sterilization. Moving on to the last part, which is conclusion. This study shows that the wear of hazmat in the offline skills lab is reasonably effective regarding the number of participants who confirmed positive COVID-19 in the past 2 months. Also, most participants obey the rules during the skills lab except when they have to make dental impressions. However, the bias of this study is we cannot determine where and when the transmission happened. Is it during the skills lab activities or outside the campus? This study can be evidence for students in dentistry fields who have lots of consideration in doing offline skills lab. Using hazmat in the offline skills lab might bother some students, but it could reduce the chance of being infected. Therefore, the wear of hazmat is recommended among dental students. Despite of all the results from this study, further study is recommended due to the bias of the study. Reaching out to the bigger scale of participants, the first time participants feel the symptoms, and the time participants visit another place other than campus is needed to be discussed. Therefore, it could be more detailed when the transmission happened and determine whether the participants were diagnosed positive because of this offline skills lab or not. I think that is all for my presentation. Thank you very much for your attention. Wassalamualaikum warahmatullahi wabarakatuh.